just think, well, if it stopped drinking or stopped using, we could go back to normal. Well, that's not true.
Yeah.
There's already a new normal. And the research tells us that if the family doesn't create a newer normal, which is move into a state of family healing, that they will continue to treat their loved one the same way they did when he was using, even when he or she is in recovery. And once that happens, then two things generally tend to happen. Either the client relapses because I'm still being treated like I'm using. Why am I going through all these efforts when no one cares? Or the client will say, you really want to stay sober, and so I'm going to not interact with my family very much. I give the analogy in my lectures is that if all solutions to a problem can fit within a basketball, how the family understands that illness would fit within a ping pong, maybe a tennis ball. I might be giving them suggestions about something that fits within that basketball but doesn't fit within their tennis ball. I think that our job is to begin to expand that from a tennis ball into a baseball, into a softball, into a football or whatever, so that we're expanding that, so that when we say, now let's really talk about what you're going to do, that they have now an abundantly larger selection of solutions.
Welcome to the Brainwaves podcast by Opus, where we sit down with industry leaders to unpack their journeys, explore key challenges, and talk about how they're shaping the future of behavioral health and healthcare technology. I'm your host, Sean Rickenbacker, and today we are joined by Dr. Michael Barnes, a counselor and educator whose work sits at the intersection of addiction, trauma, and family systems. Dr. B leads clinical programs at the Foundry Treatment Center and directs the Michael Barnes Family Institute, where he helps families move from crisis into a newer normal with skills that support long-term recovery. We'll talk about why families struggle to apply good advice, how secondary trauma shows up at home, and what a trauma-integrated family program looks like in day-to-day practice. Dr. B, welcome. It's so great to have you on the show. And to start, would you go ahead?
I was going to say thank you, Sean. It was so nice meeting you at the Good Crowd Symposium, and thank you for inviting me.
Yeah, and it sounds like you give a lot of presentations and talks in the community. So obviously you've got a fantastic background, great story. But to start, would you share a bit of your family story and how it shaped your focus on family trauma and addiction recovery?
Well, it's kind of a multi-phased process. I grew up in a family with addiction and trauma, which certainly had an impact with a lot of developmental trauma, or what many call complex trauma situations. When I was in my second semester at Florida State in my doctoral program, our 5-year-old son, who is now 38, so he survives this event, was hit by a car. And he had very severe injuries, life-threatening injuries, was actually not supposed to live the night, and he survived. So I was studying, I had been an addiction therapist for many years, was studying trauma and secondary trauma in families. And then to have that event that really drove home how our son was actually the least traumatized of everyone, and that my wife and I did everything that families with addiction do. We enabled and we tried to control, and we were hypervigilant and everything to help us kind of manage our own trauma symptoms. In the long run, began to impact our son. And he was actually the one that said to us, what do you think I'm going to do? Run out in front of another car? Let's kind of get a handle on this behavior that my wife and I were having. And so it really kind of opened the door that maybe secondary trauma and maybe addiction is a major source of secondary trauma, not just, we so often work with families as a support system for an individual with addiction. And it began my process of saying, maybe we need to start saying to families, maybe you need to heal as much as they need to heal, in order for the family to, first of all, in order for your loved one to maintain recovery, but also to help the family heal in a way that doesn't keep the client always in a client role. How do we get them kind of initiated into the family as an equal partner in the family process? And
Absolutely.
so I think the other thing that was so important to me was If you look at the diagnosis of post-traumatic stress disorder, it says you can be traumatized by experiencing a traumatic event, witnessing a traumatic event, or learning about a traumatic event of a loved one in your family. And so our son was hit. My wife witnessed it. I didn't witness it, but I was, I learned about it. And it struck me that for family therapists, particularly, to think that all three of us really had the same trauma would be completely wrong. That I was traumatized by the hospital and by the medical environment. My wife was traumatized by witnessing her son go through this experience. And her son was through the medical condition and all the things he had to go through. And how often family therapists kind of think, well, the families come here for one thing and their experience is the same. It's not the same. And working with families in addiction, their experiences are really not the same. And so it really opened the door for me to say, we need to really broaden our understanding in the addiction world. When we talk about trauma, we always think about the loved one or the client's trauma. And that's, boy, that's not it. I mean,
Yeah,
it is it, but there's so many factors to it. So long
absolutely.
story short, it turned out to show me how complicated this is.
Absolutely. I appreciate you giving us more insight into your own familial situation, how it's changed your outlook with everything you work with on a day to day. Before we started recording the conversation, obviously we talked about the events of last week and how my wife has been. She was a part of she is a part of the university, and she's been dealing with a lot of people's trauma this weekend. Not to make this about me, but it was a very difficult weekend for her, and so I'm doing my best to support her. She essentially had to relive 300 to 400 students and faculty's trauma through them telling their story, and so she wasn't at the event, but she feels like she was. How would you address that sort of trauma and like help my wife to overcome it?
Well, I think that the first thing is beginning to accept that she has been traumatized, that this is not just, she probably witnessed it. Did she witness it herself? Was she at the
She didn't
event?
see it
So
live, but plenty of videos out there.
yeah, and so people will often say, well, you can't be traumatized by a video. But when we put the pictures of the video with the stories of the students, there's two kinds of trauma that begin to happen. One is what I call systemic trauma, and that there is a trauma going through her organization, that the students, the faculty are experiencing it. She's impacted by them. And then there's what we call vicarious trauma. And vicarious trauma is the experience of trying to be a helper, which she is, to these people who have been traumatized, and hearing story after story after story that creates a secondary trauma as well. So she's kind of getting it from two different angles. One is by interacting with traumatized people on a regular basis since the shooting, but also having to kind of keep her own defenses in a place where it's not her trauma, it's their trauma, but that it impacts her on a regular basis. Families with addiction go through the same things. They're not the ones who are in the emergency room for, a car accident, but they get called and have to go there and be part of that process, just like we did as a family. It's interesting. Families tell me that the most traumatizing part of having a loved one with addiction isn't the traumatic event, but the trauma associated with the shattering of dreams, that this person's never going to be who we had always kind of hoped, or our relationship isn't going to be how we've always hoped. And so, again, that's the complexity of it. There's the systemic trauma, there's this vicarious trauma, or the sucking of energy out of someone who's trying to be supportive and helpful, as well as the shattering of belief systems that things are never going to be the same.
Absolutely. And we talked in the intro a little bit about shifting from normal to a new or newer normal. Can you tell me more about that in your practice?
Yeah, it's really interesting because families will often say to me, Why are you talking to me about trauma? I'm not the one that has the addiction." And what families don't realize, and I always think of it in terms of like a mobile over a baby's crib. And so we all know if you flick one of the elements of it, the whole thing begins to move to try to create balance. And that if we truly believe that addiction is a chronic, progressive, and potentially fatal illness, which is what the science tells us, that from the time that the loved one begins to develop, so so let's just say we're dealing with a family that has no history of addiction, that by the time their loved one begins to show symptoms, that enough problems have started to happen and enough concerns have started to happen that the family has begun to create a new normal. The original normal was before the addiction started, but that as the addiction begins to require the family to initiate interventions and try to help that person, and it's not getting better, that the family has to begin to do two things. They have to begin to learn how to live with active addiction, but also how to keep the family going and how to keep the other siblings or the partner healthy. And so they create over time a new normal that they don't realize that they've created. They just think, well, if it stopped drinking or stopped using, we could go back to normal. Well, that's not true. There's already a new normal. And the research tells us that if the family doesn't create a newer normal, which is move into a state of family healing, that they will continue to treat their loved one the same way they did when he was using, even when he or she is in recovery. And once that happens, then two things generally tend to happen. One is either the client relapses because I'm still being treated like I'm using, might as well, you know, why am I going through all these efforts when no one cares? Or the client will say, I really want to stay sober. And so I'm going to not interact with my family very much. And so I've had family members say, how they hate AA and all of these things when the client will tell their families, AA isn't why I'm not spending time with you. Your behavior is why I'm. So, in order for the individual to stay in recovery and be really healthy and for the family to heal, the family has to create this newer normal that is based on family recovery rather than just families supporting a loved one who wants to stay sober. And if we look at the symptoms of post-traumatic stress disorder and the hypervigilance and the control and the intrusive thoughts and sleep disturbances, and we look at the data on how families come into family programs with all of the same symptoms of post-traumatic stress disorder that the loved one may have, that the newer normal is really about every member in the family beginning a healing process. And we're all in this together. And
Absolutely.
you're not the one with the problem. We all are dealing with an illness that's creating problems in all of our lives. That's where we're
Absolutely.
trying to go. I think that's the future of family programming.
That we talk to a lot of people or a lot of recovery centers, and always the same. It's recovery as a family. It's like you gotta heal the village to raise the child, kind of thing.
Yeah.
We are all in it together. I know that some people, if I think back to my parents and my childhood, had I suffered from something like that, I might feel like it was difficult to get buy-in from my parents to see that like they are a part of the problem. How do you help parents and family members to like really, I don't want to say like let go of that, but like really join into the recovery and become an active part of it as opposed to a passive part or an enabler even?
I think the first thing that we try to do is help them begin to understand addiction and really so often it's that they see it as a weakness or, what we tend to forget is that how a family comes into the treatment of their loved one's addiction is impacted pretty significantly by addiction in their own family of origin. So that idea of transgenerational trauma and transgenerational, like the epigenetics of transmission of addiction from one generation to the next, is um, so we start with pretty significant educational process and really get them to begin to look at and understand addiction and then trauma. And usually by the time they get to that point, the family starts saying things like, that's really interesting, but I have those same symptoms as what you just said. And it's like, yeah, that's absolutely correct. And that's what we're going to shift into now is beginning to look at your well-being and your healing. And so a lot of times when you tell them, it's a chronic progressive disease, that their family of origin view is that it's a weakness or some other kind of view. So families ask me all the time, what do you think we should do? And I used to always tell them, and then I would realize that they didn't do it. And so now I went on for about a year and started asking families, if I tell you, will you do it? And what they told me was, well, it depends on what you tell me. And what they are really saying is, I have a belief system about what's going on. And what I'm asking is to see if we're on the same page, or, if you're going to tell me the same things that everyone else told me and that they didn't work. And so Simon Sinek wrote a book many years ago called It Starts With Why. And when I read that book, it answered the question for me that when families are asking that, they're really just trying to see if we connect. And so now what I say is, wow, that's a great question. I don't know what you've already tried. Let's begin to. So, how do you understand addiction? Do you see it as an illness? Do you see it as a weakness? So, we begin a process of building connection before we get to the. So what are you actually going to do? And so, I kind of look at. I give the analogy in my lectures is that if all solutions to a problem can fit within a basketball, that how the family understands that illness would fit within a ping pong, maybe a
Mm,
tennis ball. And
mm,
so my book is called When the Solution Becomes the Problem. And why I named it that was all of the solutions that the family can think of to try to help their loved one is based on their understanding of the illness, based on how their family handled those things, or based on a certain religious belief or a cultural belief. So that when they're asking, what should we do? I might be giving them suggestions about something that fits within that basketball, but doesn't fit within their tennis ball.
yeah.
And so I think that our job is to begin to expand that from a tennis ball into a baseball, into a softball, into a football or whatever, so that we're
Yeah. Yeah.
expanding that so that when we say, now let's really talk about what you're going to do, that they have now an abundantly larger selection of solutions. And I believe that new insights allow new solutions, and new solutions create new behaviors, and new behaviors change relationships, and changed relationships create family healing. And so I think it starts with some education and some sort of cognitive sculpting and shifting to allow for them to say, well, maybe there are some other solutions other than what I've allowed myself to do in the past. And that's what our program's all about.
It sounds like it's obviously building that trust, that rapport, so that they trust you to educate them and open their eyes to the things within the basketball that might not be within the ping pong ball or the tennis ball. And like you said before, when you ask somebody, "Hey, if I tell you what's going to work, what it is, are you going to do it?" And they're like, "Well, if it fits with my belief system," right? It's like building that relationship with them and helping them to understand that you are a trusted professional. You know what you're talking about. You've studied this, you've seen it work, that like you can help them to overcome this trauma and help them help their family members overcome trauma and addiction.
Well, and I think that the real relationship building happens when I say, that's a great question. What have you tried? And let's talk about how you understand it. That it's the curiosity and the caring of the family professional rather than the expert status. And we did a research project when I was at Florida State where we studied families that were very early in the addiction process and families that were more advanced in the addiction process. Families that were early in the process tended to want to be told more of a coaching relationship. But families who had been really through it over the course of years of trying to help wanted a really collaborative relationship, wanted a curious therapist that was going to see them as having expertise, the family as having expertise, as well as the therapist having expertise. And so a lot of times I've been known to say, well, I'm the expert in change. And you're the expert in your family. So how do we work together to build these new solutions? And try some new things, try some old things, and try to build a process that works for you all. And I think that's where the relationship happens. It's how the professional kind of lets the family know they see them as important, as boy, you can through it. You can through it all, man. Wow. The fact that you're still here is really amazing. A lot of families aren't, and so I think that's where it starts.
I
And
love that.
then having good education, an education that's understandable and not too complicated and allows them to ask questions and be curious is the other piece of that.
That being curious, building that relationship, it's two-sided. Like I said, it's a collaborative space as opposed to somebody just telling you what to do. It really helps the family to recover.
Yeah, and I think it opens the door to, particularly when they're learning about trauma, to realize maybe I've been more impacted by this than I thought. Like that idea of secondary trauma, when they get to that part, when they say, I have all of these same symptoms, so I must be, pretty impacted. So it's eye opening to them because they're seeing it through this very narrow lens. And we create opportunities to learn and expand it. That's the big piece.
And obviously, a lot of our listeners might be trying to build up to that point with their recovery center, with their practice. What pitfalls would you help people to avoid when they're trying to reach that point, the collaborative environment with the patient, the patient's family?
So, from the treatment perspective, or from the family perspective, which
Either way,
would you?
just
I can.
anything to go ahead.
Yeah, I think from a treatment perspective, one of the big things is in most programs, the family program is really almost ancillary to the treatment. And so what the family program is learning about the family that can be really helpful to the clinical team doesn't always doesn't always translate or get shared because it's and so I think the idea of setting up um, opportunities for the family program to talk with clinicians a lot and share what they're learning about the family and some things that could maybe bring down some silos for the family and bring down some silos for the clinical team about who really is the problem here. A lot of times clinical teams see the family as a problem, and the family teams tends to side with the family program or with the family. And so the more we can create that dialogue, the better that brings down those silos. And for the family, I think to convey that their work really is important and that we are going to share that with the clinical team, that the family's motivated. So often families, because when you ask them, if I tell you, will you do it? They say, well, it depends on what you tell me, are often identified as being unmotivated, when in reality, they're very motivated to stay as safe as possible, like every other traumatized client I've ever worked with. And so when we can join with them and let them know that, no, what you're sharing is really important, and we're sharing it with the team, and it is going to be a helpful way for your loved one, that it begins the process of saying, you need to heal too. Like what you're saying is going to be a part of your loved one's healing, but it also has to be a part of your healing. I think I think anytime we can give them a reason to be involved and that they are a piece of the healing, not just the loved one, but of the family, it's always we're going to be far more involved than we would be if we just we're going to teach all these things like enabling. And I think enabling is a trauma response, to be honest with you. I think to tell a family to stop enabling without teaching them how is like Nancy Reagan telling an addict to just say no. That it doesn't like it's
It's
shaming.
uninformed. It's not going to do anything.
Yeah.
And
It's
it,
like
it
well,
sounds like the most important thing is to extend that hand for collaboration and bring the family in and say, hey, we trust you. You know your family better than we do. We just want to help you.
yeah. And let's look at walk me through an enabling experience. And invariably it's well, I know I've been told not to do that. And so I'm gonna say no. And then when they go to say no, the other person now the loved one is angry and their heart starts racing and their throat tightens a little bit. And, that whole sympathetic nervous system fight flight response happens, and they get scared and say, "Well, okay, 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 I'll give you the money." And then they feel shame because I was told not to do that, and I should have been stronger. But when we can say to them, okay, let's look at how do you have those conversations where you have a support system with you so that you're not alone in that process, or how do we look at when those situations happen, how can we begin to build some new patterns for you and your support system so that you don't have to be the only one saying no. There are others saying no. That's what we try to do as much as possible, is begin to A, teach them how to regulate their autonomic nervous system, just like we do with clients in trauma integrated clinical work. Families need to have the exact same process. And so we teach them somatic experiencing techniques and grounding techniques and how they can calm themselves because they know it's going to happen. It's not like they're not fully aware that this is the biggest obstacle. It's the difference between passive coping and active coping. And active coping says, these are the times that this is going to happen. So I better prepare myself to be able to manage it in a way that's different than how I've managed it in the past, or make sure I have enough support in that process. So I get nervous when people say I'm going to avoid things
Yep.
because it's not always easy to do that.
Absolutely. Like, once again, like I've said before, and you've stated, building up the community and like helping the family to be involved is just so important. Get them involved early, show that they're trusted, help them to have the tools they need to help their loved ones and be helped by their loved ones. That, love that. Absolutely love that.
I think the other thing that's important is to try to bring as many family members together as possible. Many years ago, I did a study when I was at a different treatment center where I looked at who attended the family program. And it usually was one person from the family, and it was usually a mom, and because partners were busy taking care of kids and doing those things. So creating a family program where if they can't get to like the family week or the family intensives and those kinds of things, that there is virtual work and that it's not just one member. But I think that if it's a son or a daughter who's in treatment, I think the siblings are the real truth tellers in the family. And I try to get as many siblings in as possible. And families will often say, well, they've been through so much. I think we can let them out of this. And it's like, no, 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 no. They have been through so much, and that's why they need to be part of this. And so, but I'll take one person if that's all we can get. But someone who's really strong and wanting to create some change is awesome. But as many people as possible, in as many ways, offering services in as many ways as possible.
I love that. And thanks so much, Dr. B, for being on the show with us today. I know we are
Sure.
right at our scheduled time. I know we got started a little bit late, but you mentioned the Simon Sinek book, Start With Why. You also
Yep.
mentioned the book you wrote, When the Solution Becomes the Problem. I always ask, do you have any book recommendations to our guests? So are there any other books you'd recommend?
Yeah, there's a book that I really like called Prodependence by Rob Weiss. And so often we talk in terms of codependency. And I think codependency is really developmental trauma or complex trauma being played out from generational trauma. And Rob does a great job of talking about, um, you know, codependency is loving behavior that has really healthy boundaries so that you still do things for your loved one, but you have healthy boundaries and you don't enable and you don't give them money when they're using. And there's ways, but it really reframes it from, well, I'm codependent to, no, no, I really love my loved one. And I want to be in a positive way, um, you know, connected and parental or committed in relationship. And so we have our families read that book too. So
I'll
those
have
are
to
the
check it
three
out.
that I love. But I love, mine as well. But it just it's a pretty deep dive into addiction and trauma and healing.
I love that. And I'll definitely have to check it out because I love self-help books, but also, like I mentioned, with the recent traumas, I think this will be beneficial for me.
Sure.
So thanks so much, Dr.
Absolutely.
B. It was great having you on the show, like I said, and
Yeah.
maybe we'll have you again.
Yeah. Thank you for having me on anytime. It was great meeting you.
Yeah, great to meet you too.